So I'm getting ready to show how we replace an ostomy bag, and this particular bag is Compotech Little Ones one piece, and I actually remove all of the Duoderm that I use and his wafer with Kevlar no sting barrier film. It actually is a very good adhesive remover, and I need the film on his skin anyway, so it kind of serves a dual purpose, and it lifts up very easily like this. And his skin is very sensitive, so this has been proven to work for him over the couple years now, 2 years since he's had his ostomy. So if you can see how nicely his skin is actually, I think hopefully this method will help anyone out there that has some breakdown issues. So now what I do is I get my wet gauze. I just use simple water to clean him here. So I'll go around and scrape what I see. Not scrape, more like I just gently come around here, the edges, and do kind of wiping. I'm not putting a lot of pressure, just very much on the surface of his skin. I have wet Q-tips, cotton swabs that I actually will just kind of go around the edge of his bud. Now I use a cohesive E-Conceal ring around his stoma that I'll show here in a minute, but when I remove it, I actually start rubbing it down with a wet Q-tip to get the remnants that are sitting actually on top of his skin. This is kind of proof of how it sits on the skin and really protects him. But I do take it off each time I remove the bag and replace it. And it may be hard to see, but when you're doing this in person, you can actually see the E-Conceal glisten when it's wet, so you can see where it is. So if I take kind of a wipe down, there's spots that I can tell it's still sitting, and just do, again, I'm not rubbing very hard, it's just kind of on the top layer of his skin. And it just kind of rubs off. Another wipe to see if I see any more of that seal. Do another pass just to be sure. Okay, so it's safe to say that I've gotten it all. Nothing's coming up as I rub around it. And now I'm just gonna take a wipe here, excess water. I'll take one dry piece of gauze and just dab it so it's fully dry. And then I take another Kevlar no sting barrier film, and I go all the way around it. I kind of go up partly on the edge of his bud and actually go all on his skin that the wafer will hit. From here, I'll fan dry it, and then I will take about 1/3 of this deconceal ring and take about 1/3 here. I'm going to mold it so that it can shape a donut around his stoma. And I just fold it halfway. And it's only halfway folded, so I'd say that's fine. You don't have to manipulate it too much. And then I start at the base because I know this is where gravity takes his stool down to, so I just want to make sure that's definitely covered well. And I put it flush against his stoma around, and then create a ring, a tight ring, so that you can make sure to cover all skin that surrounds the stoma. And you just lay it down like that. I'll take his bag here, and I'm just gonna hold it between my hands to warm it slightly. And these are all prepped. I cut his hole and also added a Osto Easy Vent so that it's easy to release his gas. Sit that in, make sure I have enough room because it's next to his G-tube. I press from the center and go outward, and also kind of put some pressure around the ring. And then I add his closure. I personally like these over 2 pieces, but I'll save that commentary for another time because it has to do with how I empty his bag, which I will do a separate video on. So then here is how we seal it, and then I actually go further and I pre-cut this Duoderm extra thin dressing into strips. And at this point I just anchor the wafer on each side. This Duoderm is an amazing dressing that is flexible and it has great stick without ruining the skin. And I'll come up here on the side.
Stretchy too.
Yeah, it stretches. And the great thing too is if your bag is fine as far as having no leaks and it's just the side lifting up, it's very easy to reinforce your bag and have it last a day or 2 more. And this, for us, his bag lasts anywhere from 4 to 5 days, and usually it's not because the bag has lost integrity. It's probably because there are other issues going on, whether we're just smelling stool on the bag that we just can't get off anymore. But this here is how we secure it, and it holds up very well for us. Thank you for watching.